Hello, I'm Professor Sims, and this video is an introduction to my Anatomy and Physiology 1 course. If you're a student currently enrolled in this course, please consult the syllabus and course Moodle site for assignments, quizzes, due dates, and other course information. In this unit, we'll become familiar with course expectations, resources, and information. We'll distinguish between anatomy and physiology. We'll describe the 6 levels of organization of the human body, identify characteristics of human life and requirements for survival. We will define homeostasis, explain its importance to the normal functioning of the human body. We'll use the appropriate anatomical terminology to identify key body structures, regions, and directions in the body. And finally, we will compare and contrast medical imaging techniques and how they're used in medicine. The purpose of this course is to introduce students to the concepts and biological principles necessary to understand the structure and function of the human body. This course will provide a survey of the integument system, teeth, bones, joints, muscles, and part of the nervous system as well. It is the first of 2 semester-long courses covering all of human anatomy and physiology, and it's designed for pre-med, nursing, and healthcare students. The overall course learning objectives include describing the human body via directional and anatomical terminology, comparing and contrasting tissues throughout the body, identifying structures in the indicated body systems, relating structure to function in the human body systems, and applying the concept of homeostasis to human body systems. The textbook for this course is a free online OpenStax textbook published in 2022. Here you can find the link where you can go and download it in its entirety. The table of contents from this textbook is clickable, like you can click on the chapter title or the section that you need to read so you can jump right to that part of the book, and that is going to save you from having to scroll all the way through the book. I thought that would be a helpful tip for y'all. The Learning Management System, or Moodle, is going to have many other resources that you want to use throughout this course, such as the news forum where I will communicate to students syllabus that also has the course calendar in there. Make sure you go through that. All of your assignment guidelines and grading rubrics will be there, and other resources for writing, information about tutoring. All of the slides that go with these videos are going to be on Moodle, and of course your quizzes, exams, and any other assignment links will be there as well. I do want to make sure that I remind you guys that videos are designed to supplement for the reading assignments, not to substitute for them. Every module, every lesson is going to include a quiz. The quizzes are going to be due at the same time every week before 5 p.m. on Friday. Late quizzes and assignments and just bonuses and things in general. It's going to be very few exceptions. You'll want to look into the student handbook to see what constitutes an excused absence, and those are the cases where you can make up work for this course. All of the individual modules are going to have everything you need for a specific lesson, including the learning objectives, all of the grading policies, and the way that the grades are calculated. All of those things are going to be in the syllabus. And I do have office hours. They are virtual. There's a link on the first page of the Moodle shell where you can make appointments for office hours whenever you need one. I encourage students to study smarter, not harder, by which I mean you want to get more out of your study time and you want to learn more in less time. So what I see a lot with my students over the years, I've seen them using these techniques here on the right for studying, things like rereading, rewriting, going over old quizzes, going over old class notes. And that's fine, except it's very, very time consuming. And at a certain point, your brain kind of burns out, especially if you're doing so much rereading and rewriting and rewatching that you're losing out on sleep time, because your brain needs sleep in order to form new neural connections and memories. So I would like to encourage students to kind of shift away from these methods here on the right and shift towards these ones on the left, which have been scientifically proven to not only take less time to do, but they're more effective as far as long-term memories and comprehension of material is concerned. So you are going to do some rereading and rewriting, but what you really want to do is fill in the gaps of your knowledge. You need to kind of take inventory of what you do and don't understand and spend your time focusing on the things that you need more help with. So you're going to write things in your own words. You want to test yourself, like write little mini quizzes and tests for yourself and answer them. And you want to try to interleave things. So you want to try to relate the new things that you're learning to things that you've already learned. And you also want to vary your studying in such a way that you're not spending huge blocks of time doing one activity or studying one concept. So you don't want to spend, 4 hours at a time just reading the textbook because, about 20 minutes into that, your brain kind of shuts off. You want to take breaks. You want to alternate between reading activities and writing activities and maybe other types of activities like watching a video or a simulation, or maybe if you're good at drawing and you're a visual learner, maybe you want to make a diagram or a figure or something like that. Anyway, you want to switch it up and make sure that you're studying smarter. Let's get into our overview of the Introduction to Anatomy and Physiology. Human anatomy is the scientific exploration of the body's structures, ranging from tiny components observed with a microscope to larger structures visible without magnification. The term anatomy originates from a Greek root word meaning to cut apart, reflecting its historical association with dissecting bodies for study. Dissection, which involves cutting apart bodies to examine the physical attributes and relationships of structures, is still employed in medical education, anatomy courses, and pathology labs. Imaging techniques developed to observe living structures play a crucial role in visualizing internal aspects like tumors or fractures. Anatomy specializes in gross anatomy, focusing on visible structures without magnification, and microscopic anatomy, which studies small structures observed with a microscope. Microscopic anatomy encompasses cytology, which is the study of cells, and histology, which is the study of tissues. Advancements in microscope technology enable the examination of increasingly smaller body structures. Two main approaches in anatomy study are regional, which is examining structures within a specific body region, and systematic, which is exploring structures within a body system. Figure 1.2 shows examples of gross and microscopic anatomy. Gross anatomy is going to be your larger structures that you can see with the naked eye. Figure 1.2 gives an example of the brain, whereas microscopic anatomy is dealing with the same structures but on a very much smaller scale. So figure 1.2b is showing individual nerve cells from within inside of the brain. So anatomy is going to cover the macro and the micro in this way. Physiology delves into the chemistry and physics of body structures and their interactions that support life functions. Homeostasis, the maintenance of steady internal conditions, is a central theme in physiology. Physiologists specialize in branches like neurophysiology that focuses on the nervous system's functions from organs to molecular level. And the relationship between form and function is evident in all living things, but is exemplified by the coordinated action of nerves, muscles, and molecules in various body parts. Understanding the interplay between anatomy and physiology, the connection between form and function is essential for a comprehensive grasp of anatomy and physiology, as demonstrated by the example of understanding hand structure through its role in tool manipulation. A&P is about combining both the macro and micro and understanding how the forms allow for specific functions. The body's organization is commonly categorized into increasing levels of complexity. You have subatomic particles, then atoms, then molecules, organelles, cells, tissues, organs, organ systems, organisms, and then the biosphere. Elements like hydrogen, oxygen, carbon, etc., these constitute all matter. Atoms are the smallest units of elements, composed of subatomic particles like protons, electrons, and neutrons. Molecules such as water, protein, or sugar, these are the chemical building blocks of the body's structures. A cell is the smallest independent unit in a living organism. Even bacteria, as small independent organisms, have cellular structures. Cells, enclosed by flexible membranes, contain cytoplasm and organelles, performing all life function. Tissues are groups of similar organisms working together for specific function. Organs are anatomically distinct structures with 2 or more tissue types, each performing specific physiological functions. Organ systems consist of organs collaborating to fulfill a specific function or a physiological need. The book covers 11 organ systems in the human body, acknowledging the imprecision in assigning organs to systems, as many organs contribute to more than one system. Descriptions related to biological sex are discussed in the book, recognizing the difference between gender identity and biological sex. So, female and male are referring only to the biological sex, discussing the typical anatomy and physiology of individuals that have XX or XY chromosomes. The highest level of organization is the organism level. An organism is going to be a living being with cellular structure that independently performs all of its physiological functions necessary for life. In multicellular organisms like humans, all levels, cells, tissue, organs, and systems collaborate to maintain the life and health of the organism. Figure 1.3 shows the level of structure or organization in the human body and the distinct levels. So there's 6 distinct levels, and these are chemical, cellular, tissue, organ system, and organism.
Levels of organization of body structure and function. How are body parts organized, and how do they work so well together? In order to understand the human body and anatomy, it's good to break things down into levels. In this video, we're going to look at the 7 levels of organization of body structure and function. The first level is the chemical level, and it starts with atoms, which make up every material thing in the universe, including our bodies. Atoms can bond together to form molecules, which are larger chemical groupings, and molecules can combine with other molecules and more atoms to form macromolecules. The next level of organization in the body is the organelle level. Organelles are made up of chemical groupings, and they are tiny organ-like things that are in cells. Organelles have specific functions in cells, and they cannot live outside of cells. And without organelles, cells cannot survive. The cellular level is next. Cells are the smallest unit in the body that shows the basic characteristics of life. It's estimated that the body has around 100 trillion cells, and each cell is made up of a membrane, a nucleus, and a cytoplasm that houses the organelles that are required for the cell to function properly. There are many different types of cells in the body that perform different functions in the body. The next level is the tissue level. Tissue is a group of similar cells that have developed from the same part of the embryo and all perform a certain function. Tissue cells are surrounded by the matrix or non-living intracellular substances. There are 4 major types of tissue in the body: connective tissue, muscle tissue, nervous tissue, and epithelial tissue. Next up is the organ level. Organs are made up of different kinds of tissues that together can perform different functions in the body. For example, the liver, which is an organ located in the abdominal region of the body, stores some vitamins and minerals, stores glycogen, which is a stored form of energy, helps to destroy old red blood cells, and helps to detoxify the blood to get rid of harmful substances. The next level of organization in the body is the system level. Systems are comprised of organs that, by working together, can perform more complex types of functions in the body. There are 11 major systems in the body. Many times systems work together to accomplish different needs of the body, such as the respiratory system takes oxygen in, and the cardiovascular system transports the oxygen to various parts of the body. The organism level is the last level. The overall human organism is made up of all the previous levels we just covered.
Figures 1.4 and 1.5 show the organ systems of the human body. Organs that are grouped together are called organ systems. So your skin is an organ system. That's your integumentary system. The bones make up the skeletal system. Then you have the muscle system, the nervous system with all of your nerves and your brain, spinal cord. The endocrine system, so that's the glands that make all your hormones. And then your cardiovascular system, so that's going to be your heart and veins, arteries, and this is how all of the cells in your body get oxygen. Then you have the lymphatic system. This is the blood itself and other fluids in your body that help maintain homeostasis and fight off pathogens. The respiratory system are going to be the organs that make up the system that helps your body obtain oxygen and get it into the blood. Your digestive system, so this is going to be your stomach, your bowels, and so on. Urinary system, so your kidneys, your bladder. Then you have the male and female reproductive system. Each organ system has unique functions that are important for human life. These are organization, metabolism, responsiveness, movement, development, and reproduction. The term organization refers to the trillions of cells that are organized to maintain distinct internal compartments. Internal compartments protect cells from external threats and separate body fluids from microorganisms. Membranes and connective tissues maintain the separation of body structures. Metabolism is the ingesting of energy and molecules and then converting those into energy for movement, body functions, and structure. The two types of metabolism are anabolism and catabolism. Anabolism is where smaller molecules are combined into larger substances. Catabolism is where larger, more complex substances are broken down into smaller molecules, releasing energy. Figure 1.6 illustrates anabolic and catabolic reactions in metabolism. So here you can see the catabolism is going to release energy. It's taking larger substances like food that you eat and breaking them down into smaller molecules. Whereas anabolism is going to take the smaller molecules and puts them together in order to make larger, more complex substances, and this process actually uses energy. Figure 1.7 gives an example of marathon runners that are demonstrating two more characteristics of living humans, those being responsiveness and movement. So the anatomic and physiological structures and processes in the human body are allowing these runners to coordinate the action of different muscle groups and the production of sweat in order to respond to their rising internal body temperatures. So responsiveness in general is just an adjustment to internal and external environmental changes. Examples include moving towards food, sweating, the dilation of blood vessels in response to temperature change. Movement encompasses joint actions, organ and cell motions. Muscle contraction, blood cell movement, and organ functions all contribute to movement. Skeletal muscle contraction enables intentional movements. Development refers to the changes that occur throughout one's life, including different cell differentiation, growth, and repair. Growth is just the increase in body size that occurs due to increases in cell numbers, non-cellular materials, and of course just cell size. Reproduction is the term given for the formation of a new organism by the original organism or organisms. In the case of humans, reproduction is accomplished through the male and female reproductive systems. Humans have been adapting to life on Earth for over 200,000 years, and this adaptation relies on the planet's air, water, food, temperature, and pressure conditions. Oxygen comprises 20% of the atmospheric air, and it's essential for chemical reactions, especially those producing ATP, or energy that's used by the cells. The brain, which is sensitive to oxygen deprivation, faces damage within 5 minutes of not having oxygen, and this leads to death in about 10 minutes usually. Nutrients crucial for survival include water, with energy-yielding nutrients like carbohydrates and lipids, and micronutrients like vitamins and minerals. Water sustains body functions. dissolves chemicals and constitutes about 70% of adult body mass. Energy-yielding nutrients provide fuel for metabolic processes, and micronutrients contribute to essential chemical reactions. We'll talk some more about that later. A narrow temperature range of about 37 degrees Celsius, which is 98.6 degrees Fahrenheit, is vital for maintaining chemical reactions and metabolisms. And extreme temperatures can lead to heat stroke or exposure-related death. Short-term heat exposure triggers sweating, cooling the body, while cold exposure induces shivering and increased energy breakdown for heat generation. Prolonged cold exposure may result in frostbite, tissue damage, and reduced blood circulation to the extremities. Atmospheric pressure exerted by the Earth's atmosphere plays a role in human survival as well. Atmospheric pressure maintains gases in body fluids, regulates breathing, enables oxygen and carbon dioxide exchange as well. Altitude sickness is an example where high altitudes reduce atmospheric pressure, and this affects gas exchange and causes symptoms like shortness of breath and confusion. Blood pressure is also important. Blood pressure needs to be sufficient for blood to reach the tissues, but it also needs to be low enough for vessels to stay intact. Dynamic pressure in body fluids is essential for human survival, and altitude climbers carry oxygen in order to counter low oxygen levels and barometric pressure at higher altitudes. Figure 1.8 gives an example of how humans living in hot, dry desert climates have adapted in order to acclimate to some degree of repeated exposure to high temperatures. Figure 1.9 gives another example of harsh conditions that humans have adapted to. That is, people that climb Mount Everest, they have to adapt to extreme cold, low oxygen, and low barometric pressure. Maintaining homeostasis involves continuous monitoring of internal conditions in the body, with each physiological parameter having a specific set point and normal range for optimal health and stability. For example, the human body temperature set point is around 37 degrees Celsius, but it fluctuates within a few degrees above and below. Control centers, primarily in the brain, employ negative feedback to monitor and counter deviations from homeostasis. This process is fundamental to understanding human physiology, and it encompasses various physiological conditions. A negative feedback system comprises three components. One is a sensor or receptor that monitors physiological values. Two is the control center that compares values to the normal range. And then lastly, you have an effector that causes changes to return the value to the normal range. Stimuli drive physiological parameters beyond homeostasis and activate specific sensors. For example, in blood glucose control, pancreatic beta cells detect excess glucose and they release insulin to lower the blood sugar. Similarly, humans have a temperature and regulation system promoting either heat loss or gain. When body temperatures exceed the normal range, the brain's heat loss center triggers responses like dilated blood vessels, increased sweating, and enhanced respiration in order to dissipate the excess heat. Figure 1.10 illustrates the negative feedback system. In a negative feedback system, a stimulus is resisted through a physiological process that returns the body to homeostasis. A negative feedback system has 5 basic parts. They are the stimulus, sensor, control, effector, and then response. Body temperature regulation is an example, like we said, of the negative feedback system. Exposure to cold activates the brain's heat gain center, reducing blood flow to the skin and triggering mechanisms to conserve heat, such as shivering and increased metabolic activity. Positive feedback intensifies a physiological change, and it moves the system away from the normal range, but it's normal only with a defined endpoint. So childbirth is an example of positive feedback, where contractions push the baby down the birth canal, and this stimulates further contractions until birth is complete. Another example is the body's response to blood loss, where clotting substances are released in order to accelerate the clotting process and seal off the damaged area. And this prevents excessive blood loss and helps to ensure survival.
Did you know just sitting here right now, you're doing something absolutely remarkable? Well, your cells, tissues, organs, organ systems, yes, we just leveled up those biological levels of organization, they're all working towards something called homeostasis. It's a state of balance. Yes, homeostasis means many things in your body. For example, that your blood stays within a certain pH level range. It means that your blood glucose remains within a certain range. It means your internal body temperature stays within a certain range. See, we've mentioned the major body systems before and that they work together. And today we're going to talk about how they work together using something called positive and negative feedback. And also how this relates to homeostasis. You are warm-blooded, or the fancier term, an endotherm. Your body works hard to keep the internal temperature it keeps. It's also a beautiful example of something called negative feedback. Before we define it, let us show you this example. Say you're in an environment that is very hot, like being outside in the Texas summer heat. That's typically hot. Thanks to nerves which can act as sensors, the brain notices this. It will send signals to counteract this variable. Sweat glands do what they do best, sweat. Heat is lost as that sweat evaporates off your skin. You may have some redness too. That's because your blood vessels are getting wider, dilating, in order to help get rid of that heat. And the result, whether you realize it or not, helps you lower your body temperature. But wait, what if you go inside now and the AC is blasting? You'll stop sweating. You may even shiver. The muscle contractions of shivering can generate heat. And those blood vessels will now decrease in diameter size, constrict, to help you conserve the heat because that makes it harder for the heat to escape. Your body temperature can increase then. This is negative feedback. So a simplified definition, negative feedback is when some variable triggers a counteracting response in order to come back to some set point. If we consider that this whole thing is actually a negative feedback loop, we can see that the negative feedback brings the body back to the set point, which in this case is a stable temperature, keeping homeostasis. Negative feedback is also going on in the regulation of your glucose, your blood sugar. Okay, we're really simplifying this here, as we often do. But when glucose, blood sugar, is too high, one hormone that is released is insulin. I always imagine insulin as this hormone that makes the cells say, feed me, because it has the ability to make cells take in glucose. On the flip side, if glucose is too low in the blood, a hormone called glucagon can be released. This hormone can have many effects, and one of them is that it can cause the liver to release glucose into the blood. There's more to the regulation of blood sugar than this, but you can see how this is negative feedback. You have counteracting responses here in order to keep homeostasis. So, what about positive feedback? Positive feedback is when, instead of getting a counteracting response to some variable, you instead intensify the variable. Positive feedback can be like more, instead of let's counteract this. The example that always stuck with me when I was a student is the example about the human baby being born. In biology classrooms everywhere, it's a classic example. When a human baby is ready to be born, there is pressure on the cervix, and that pressure and the hormones involved cause contractions of the uterus, because that's a big part about how the baby is going to be born. More release of hormones will equal more contractions and pressure, which will cause more release of hormones. And more release of hormones will mean more contractions and pressure. Contractions help get the baby out, but it's also a part of a beautiful illustration of what positive feedback can do. So why do we care about feedback? Other than, the importance of negative feedback in maintaining homeostasis and the role of positive feedback in many body processes. Well, we also need to understand feedback so we can understand what is happening when there is a problem in the feedback systems. One example, perhaps you've heard of type 1 diabetes. It's a disorder that can mean that your pancreas, which is an organ that is involved with making some hormones like insulin, is not working correctly. Insulin is not produced, and because of that, one issue is that you're not going to be able to get glucose, the blood sugar, into your cells. Now, glucose outside of the cells cannot be used in cellular respiration. The cells need to take the glucose in to make ATP energy in cellular respiration. Therefore, your cells need to be able to take in the glucose to survive. So many type 1 diabetics need to give themselves insulin and monitor their blood sugar because the negative feedback may not work as it should.
Anatomical terminology eliminates the ambiguity in describing anatomical locations. These terms are rooted in ancient Greek and Latin, and they remain stable in meaning over time. This contributes to clearer communication, right? Composed of roots, prefixes, and suffixes, anatomical terms provide specificity, such as hypertension, where hyper indicates high or over, and tension refers to pressure. Standardizing body orientation in the anatomical position involves an upright stance with feet shoulder-width apart, upper limbs at the sides, and palms facing forward. This standardized position reduces confusion in descriptions, irrespective of the body's orientation. Terms like prone, which means face down, and supine, which means face up, describe body positions when laying down. Specific regional terms like brachium for upper arm and femur for thigh further increase precision of the terminology. Directional anatomical terms are important for describing the relative locations of body structures. Examples include anterior, which means front, posterior, which means back, superior, which is above, inferior, which is below, lateral is side, medial is middle, proximal is nearer, and distal is further. Superficial is closer to the surface, and then you have deep, which is farther from the surface. Figure 1.12 shows the regions of the human body in anatomical position. The left side is the anterior view, and the right side is the posterior view. And all of the different regions of the body are labeled. So if we start at the top here, the anterior view, you have the frons, cranium, facies, oris, mentis, axilla, brachium, antecubilis, antebrachium, carpus, pollex, palma, digits or phalanges, patella, crus, tarsus, and again digits or phalangia, and then halix. Going back up to the top, you have the oculus, bucca, aurea, nasus, cervicis, thorsus or thorax, mammo, abdomen, umbilicus, hip, pelvis, groin, pubis, femur, and pes or petals. In the posterior view, some of these are going to be repeating, but you have the cephalon, the cervicus, upper limb, lower limb, shoulder, dorsum, brachium, olecranon, lumbus, sacrum, antebrachium, manus, gluteus, femur, popliteus, sura, calcaneus, and planta. Figure 1.13 illustrates the directional terms that are used when describing the anatomy of the human body. So first we have superior, which is above, inferior is below, cranial is closer to the head, whereas caudal is closer to the lower limb and the gluteus. Posterior or dorsal is going to be the back, right? And then anterior is the front. It's also known as ventral. And then right and left is going to be in terms of the body itself. So it's going to be this lady's right and left, not my right and left. So right, lateral, medial is in the middle, proximal is nearer, distal is further. Body planes aid in understanding the different anatomical sections. These include sagittal, which divides the body vertically, frontal, which divides the body into anterior and posterior, and then transverse, which divides the body horizontally. Major body compartments, the dorsal and ventral cavities, house internal organs and maintain organization. Posterior cavities include the cranial and spinal cavities. Anterior cavities include the thoracic and abdominopelvic cavities. Figure 1.4 shows the planes of the body. The three planes most commonly used in anatomical and medical imaging are the sagittal, frontal, or this is sometimes called the coronal plate, and then the transverse plane. This is sometimes called the coronal plane, and then also the transverse plane. The dorsal and ventral body cavities are illustrated in figure 1.15. The ventral cavity includes the thoracic and abdominopelvic cavities, and then, of course, there's subdivisions as well. So subdivisions of the thoracic cavity include the superior mediastinum, pleural cavity, pericardial cavity. Then here you have the diaphragm, then the abdominopelvic cavity includes the abdominal cavity and the pelvic cavity. Abdominal regions and quadrants divide the cavity into 9 regions and 4 quadrants. So the 9 regions are superior to the pelvis and inferior to the ribs, with 2 vertical and 2 horizontal lines, or 4 quadrants with an intersection at the umbilicus. Serous membranes are thin coverings for the walls and organs in the thoracic and abdominopelvic cavities. The serous membranes help in reducing friction and cushioning the organs, comprising the parietal layers on cavity walls, visceral layers on organs, and fluid-filled serous space. They contribute to the protection of enclosed viscera. The 3 main serous cavities are the pleura, pericardium, and peritoneum. And this is an illustration of those. They're the different regions and quadrants of the peritoneal cavity. So you have the right and left hypochondriac region, right and left lumbar region, right and left iliac region. Then in the middle here you have the epigastric region, umbilical region, and hypogastric region. So those are your 9 regions. As for the 4 quadrants, you have the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. Figure 1.17 helps to illustrate the serous membrane that lines the pericardial cavity. This is the cavity that protects the heart. And it cushions the heart similar to how if you had an underinflated balloon wrapped around your hand and you punch the wall, right? The underinflated balloon would help protect your knuckles and keep you from breaking any of your phalanges. Historically, anatomists and physicians face limitations in studying the human body's internal structures due to them being, internal. Surgical procedures were often infrequent and limited to basic interventions, so they provided minimal insights into the internal anatomy. Advances occurred in the 14th and 15th centuries, at which point we had detailed anatomical drawings by Leonardo da Vinci and Andreas Vesalius. And this led to increased interest in human anatomy. Medical schools started teaching anatomy through human dissection, and this was quite controversial sometimes because sometimes students and professors would resort to grave robbing in order to get cadavers. In the late 19th century, non-surgical methods to visualize the living body emerged. The discovery of X-rays by Wilhelm Röntgen in 1895 revolutionized medical imaging. X-rays are high-energy electromagnetic radiation that is passed through the body, and it creates images based on tissue density. While widely used, X-rays pose risks of cell damage and even cancer due to radiation exposure. Refinements in X-ray techniques continued, though, so this is a type of medical imaging that is still valuable for finding bone fractures and also for examining teeth, which makes it very useful in dentistry. Modern medical imaging that is even better than X-rays exists now. So we have computed tomography, which is the CT, and this uses cross-sectional X-rays analyzed by computers for detailed images. Right? CT scans have been routine now since the 1970s, and they produce precise soft tissue visualization, but they expose patients to a higher level of radiation than X-rays. Magnetic resonance imaging, the MRI, was introduced in the 1980s and relies on nuclear physics to produce detailed images without radiation exposure. However, MRIs are quite costly and they require patients to endure confinement for quite a while and really, really loud noise. Positron emission tomography utilizes radiopharmaceuticals to illustrate physiological activity in the body. These types of scans offer insights into organ function. Ultrasonography is an imaging technique using sound waves. It's the least invasive and commonly used, particularly in pregnancy. However, it depends heavily on the operator. It can't penetrate bone and gas, and it has limited image quality. Figure 1.19 gives an overview of these different types of medical imaging techniques. You can see here the series of transverse sections that are given by the CT scan. So these are cross-sectional x-rays. So it's basically just x-raying very thin transverse sections so that you get a more complete view of the whole internal system. This here is an MRI machine, and I'm claustrophobic, so this is just scary to look at. That you end up going inside of this tube here, and they turn it on, and it makes all these weird loud noises, and you have to stay very, very, very still while it's taking a whole bunch of images. The PET scans here, these are images that allow for you to see blood flow and different physiological activity of the organs. And then ultrasounds are here. These are the least invasive method of imaging, but they're also very highly dependent upon interpretation by the person taking the images. Let's watch this clip about medical imaging now.
Doctors have been appropriately using medical imaging or photos to see what is going on inside your body. These images can help screen for possible medical conditions before symptoms appear, diagnose the likely cause of existing symptoms that you have, or monitor health conditions that have been diagnosed and the effects of treatment for them. The different types of imaging include x-rays, CT scan, MRI, ultrasound, and nuclear medicine imaging, just to name a few. Each imaging type uses different technology to create an image of a part or a system in your body. So what image is right for you? Your healthcare professional should discuss with you which image is most appropriate for you in your current situation. All right, here we go. Let's get into the basics of each image. The plain x-ray. The x-ray is a basic medical image that you may have heard of before if you've broken a bone. Did you know that the x-ray could also look for simple lung infections? If you have a collapsed lung, it could also look for some tumors, and it also will help with some abdominal problems. Sometimes we can do continuous x-rays during specific procedures. That way doctors can see in real time what is happening. Super cool. This is very common when you're having a cardiac catheterization for your heart. Advantages of the x-ray is it's quick, non-invasive, and painless. And like I said before, it can help diagnose various injuries and diseases, including broken bones, some cancers, and infections. The disadvantages of an x-ray include the small increased risk of cancer in the future from exposure to the ionizing radiation. And I'm sure you can guess that the risk is even greater for children. Next most common image is the computed tomography scan, also known as the CAT scan, also known as a CT scan. The CT scan uses hundreds of x-rays to produce cross-sectional images that detail the inside of our body. Just like when your grandmother magically puts that 3,000-piece puzzle together, voila! The computer also magically puts hundreds of x-rays of images in 3D form. This is good for bones, organs, tissues, and tumors. The advantage of the CT scan is that it's quick and painless. It can help diagnose and guide treatment for a wide variety of conditions that the plain x-ray can't, can detect or exclude the presence of more severe problems, and can be used to check if the previously treated disease has reoccurred. Sometimes we order a CT scan for issues like appendicitis, bleeding in your brain, kidney stones, and a whole array of other symptoms and issues. Disadvantages: small increased risk of cancer in the future from exposure to the ionized radiation, just like x-rays, and the risk is also greater in children. Remember, it's like having hundreds of x-rays. It uses higher doses of radiation than the plain x-rays, so the risk, although small, is generally greater than other image types. Injection of contrast medium or dye can cause kidney problems or result in an allergic or injection site reaction in some people. Some procedures will also require sedation or anesthesia. All right, moving on to the MRI, or the magnetic resonance imaging. This image uses magnetic fields and radio waves to show detailed images of organs, soft tissues, bones, ligaments, and cartilage. This is a good image for joint injuries, spinal injury, brain masses, strokes, spinal cord compressions, and appendicitis in pregnant women, and there's a few other reasons for the MRI. While MRIs cause no radiation exposure, they cannot be used if you have any metal in your body. Advantages: it's usually non-invasive and painless, uses no ionizing radiation, and can provide very similar information that the CT scan can give you for certain types of investigations. Disadvantages: it can take a lot of time and be quite noisy to get this done. Any slight movement will distort the image and will have to be retested, and it's very costly. If you're claustrophobic, the study might not be good for you. Sedation and anesthesia may be required for young children and others who just can't remain still. Injection of contrast medium or dye, if needed, can also cause the same problems that a CT dye can cause. This cannot be undertaken in some situations, especially for people who have a pacemaker in place. All right, the ultrasound. Like the name suggests, the ultrasound uses high-frequency sound waves to produce moving images on a screen of the inside of your body, including organs, soft tissues, bones, and most commonly used for the unborn baby. Advantages: it's usually non-invasive, safe, and relatively painless, uses no ionizing radiation, does not use any contrast or dye or medium. Disadvantages of the ultrasound: the ultrasound has many limitations. Quality and interpretation of the image depends on the skill of the person actually doing the scan. Other factors can affect the image quality, including the presence of air or calcified areas in the body, for example, bones, plaques, or hardened arteries, and a person's body habitus or size. All right, next imaging modality: nuclear medicine imaging, including positron emission tomography, otherwise known as the PET scan for short. This scan involves the injection or the inhalation or swallowing of a radioactive tracer. The gamma rays emitted by this material are used by the scanner to show images of bones and organs. We do this for bone scans, PET scans, which are used for monitoring cancer and other active processes, while we also use the HIDA nuclear scan, which shows a function of your gallbladder. Advantages: usually painless, can help diagnose, treat, or predict the outcome for a wide range of medical conditions. Unlike most other imaging, the nuclear image can show how different parts of the body are working and is able to detect problems much earlier. Can check how far a cancer has spread and how well the treatment is working. Disadvantages: this involves exposure to ionizing radiation as gamma rays. Radioactive material may cause allergic reaction or injection site reactions in some people. PET scanners can cause people to feel claustrophobic, which may mean...
Thank you guys for watching. Don't forget to do the reading. Check the description for more videos related to these topics, and leave your questions for me in the comments below.